If you've ever been told your labs are normal, but you still feel absolutely nothing when it comes to desire, aka libido, this video is for you. The standard hormone panel that most doctors run is not designed to find the root causes of low libido. And in this video, I'm walking you through 4 hormonal imbalances that are incredibly common in women that directly kill desire, and that most providers never even look for. By the end of this video, you will know exactly what to ask for and why it matters. Root cause 1, low testosterone. Yes, women have testosterone, and yes, women need it, especially for libido. Testosterone is one of the most important hormones for female desire, and low testosterone is one of the most common and most missed root causes of low libido I see in women. When your testosterone is low, desire doesn't just decrease, it flatlines. You don't think about it, you don't miss it, you just feel nothing. And that nothing starts to feel like your new normal. So what drives low testosterone in women? A few things. Chronic stress, undereating, especially fat and protein, one of the biggest hormonal birth control. The pill specifically raises a protein in your body called sex hormone binding globulin. And what SHBG does is exactly what it sounds like. It binds to your sex hormones so your body can't actually use them. So even if you're producing testosterone, SHBG locks it up. It becomes unavailable, and what you feel is nothing. Here's the part that makes it even more frustrating. SHBG can stay elevated for months or even years after you stop birth control. So if you stopped the pill 2 years ago and you're still wanting to feel like yourself, this could be exactly why. What can you do nutritionally? Eggs, especially the yolk. Cholesterol is the raw material your body uses to make sex hormones. Grass-fed red meat for zinc and saturated fat. Pumpkin seeds, one of the highest food sources of zinc. Avocado for healthy fat, and oysters, the original aphrodisiac for a reason, the highest zinc food on the planet. Root cause 2, high cortisol. When cortisol, your stress hormone, is chronically elevated, your body actually steals the raw materials meant for sex hormone production and redirects them to keep you alive and functional. It's called the cortisol steal, and your body will choose survival over reproduction every single time. Your libido isn't broken, your body is just prioritizing. This is one of the most common patterns I see in women in their 30s who are high achieving, overcommitted, and running on fumes. They come to me saying their desire is gone, and what I often find is a nervous system that has been in overdrive for so long that it has completely deprioritized anything that isn't essential. Nutritionally, magnesium is one of your most important allies here. Dark leafy greens, dark chocolate in moderation, blueberries. Salmon for omega-3s, which reduce cortisol reactivity and support your adrenal glands. And adaptogenic herbs like ashwagandha, which is one of the most researched for cortisol and libido specifically. But food alone won't fix chronic cortisol. The nervous system piece has to be addressed too, and I have an entire video on that if you want to go deeper. Root cause 3, high prolactin. Your body has a built-in off switch for desire. It's a hormone called prolactin. Prolactin is supposed to be high when you're breastfeeding. It's your body's way of saying, not right now, do not get pregnant right now. It's protective and purposeful in that context. But some women have elevated prolactin even when there is no biological reason for it, and it quietly flattens everything: desire, arousal, all of it. Most doctors never check prolactin in the context of libido, and I see it elevated all the time. What supports healthy prolactin levels? Vitamin B6. Foods like salmon, chicken, bananas, and pistachios are rich in this. Zinc-rich foods. And reducing alcohol, because even moderate alcohol raises prolactin meaningfully, and most women have no idea that's what's happening. Vitex, also called chaste tree berry, is the most commonly recommended herb for elevated prolactin, and worth knowing about, though I always recommend working with a provider before adding herbs to your routine. Root cause 4, low estrogen. Estrogen supports blood flow, lubrication, tissue sensitivity, and mood. When it drops, which can happen in perimenopause, postpartum, or under chronic stress, intimacy can become physically uncomfortable or even painful. And when intimacy hurts, your nervous system starts associating it with pain, not pleasure. Desire follows. This is something I experienced personally, and even though I had high serum estrogen, I had low tissue estrogen. This is something that is rarely talked about with honesty. Physical pain during intimacy is not something you just push through. It needs to be addressed at the root, because your body will not generate desire for an experience it expects to hurt. Here's what I want you to take away from this video. If you have been told your hormones are fine and you still don't feel like yourself, ask specifically about testosterone, free testosterone, SHBG, DHEA, prolactin, and estradiol. Those are the numbers that matter for libido. And if your provider won't look at them, find one who will. You deserve answers, and you deserve to feel like yourself again. I'm Dr. Leah, a naturopathic hormone and fertility doctor, and a woman who has lived this and has done the work to overcome the obstacles that were contributing to my desire. The key is understanding your unique combination of root causes, what I call your desire code. Discover your desire code at the link in the description and find out exactly what's driving your low desire and where to start. And if this video gave you language for something you've been experiencing but couldn't explain, please share it. Another woman needs to hear this today.